Hello 10, 11, and 12. This is your staff terminal re-educational update. Remember, this touchscreen is a simple black screen with a clock on it unless something's going on. When I press the screen once, this is the screen that appears. You have a high acuity option, which would indicate that the patient in this room is of higher acuity than the average patient on the floor. So if they call out for help, toilet, or a nurse, they probably need me sooner rather than later. Isolation sets off a yellow light outside of the door. Yellow light means yellow gown. Still look for the sign that indicates contact or droplet or any sort of specialty isolation. But this is a sign, another visual sign, pardon me, to help us remember to put on our PPE. High falls risk sets off a single light outside of the room to indicate that this patient has a high falls risk. And that means if they call out for help, toilet, or I see them trying to get out of the bed when I walk by, I need to run in and help them. Restricted visitors sets off a light outside of the room similarly to the high falls risk button. So this visual cue will show me that if I see lots of patients going in and out of the room, something might be wrong and I should investigate. The timer goes to another screen. The timer gives me the option of 15, 30, 45, or 60 minutes. If I were to press one of these, you'll see a yellow box around it showing me that as the button I have selected, and in 15 minutes it would send alert to my phone if I was the RN assigned to this room. To cancel it, I simply press the button again, and you'll see the red line around the button has gone away. To go back, I press back or home. Discharge orders written is a great button for our physician partners and mid-levels to use. It means that they've been in the room and done the final sign-off with the family member or parent that is responsible for the patient going home. It also means that orders are written, so when I open PowerChart, I can print out my final discharge summaries and do my final discharge teaching and improve our throughput. Down here, you'll see a button called Clean Screen. I'll show you what that does at the end. EVS indicates that EVS help is needed here. This is not to be used for discharges, but rather when my trash is full, the floor needs mopping, or I need some other sort of service from EVS. When I press the EVS button, it alerts the EVS personnel assigned to my floor with an indication that says EVS needed and the room number. It also sets off white and orange flashing lights outside of the room, so they know what to look for. If I go to the next screen by pressing medical emergency, remember, this is what you use when you need help. There are a couple of options. Neo-emergency would call the neonatal code team. It would set off pink flashing lights outside of the room and alert everybody on my floor or unit on duty that there is an emergency in the room. You would use this button if a NICU baby or a small infant needed help from the NICU code team. Missing child actually calls 1028 Main, which is the headquarters of our security office. When that happens, an officer will answer and they will actually speak to you through this speaker. And they will say things like, do you have a missing child? What room are you in? Can you describe them? And you confirm that your patient is missing. Back to missing child. Amber or orange colored lights will be outside of the room when this happens. Obstetric emergency will set off pink flashing lights just like the neonatal emergency button did. Obstetric emergency means I need OBGYN emergency personnel here now. So the simplest example I can give is a baby's being born where they're not supposed to be. RT calls the RT therapist assigned to your floor. It will tell them the room number where they are needed. Rapid response is how you call our rapid response team. Red flashing lights will take place outside of the door, an alarm will go off, and the stat team will get this alert. Remember, rapid responses have a 10-minute response time, so if you need somebody now, hit the big blue button. This is the medical emergency or code blue button, and this calls the stat team along with the ED charge nurse. This means I'm coding a patient, I need you here now. Staff assist gets you help from within the floor. So staff assist does not get you a provider or somebody who could intubate, rather it gets you your fellow nurses, MAs, NAs, and respiratory therapists that are on duty for your floor. So staff assist means I need help, medical emergency means I'm coding or I need the stat team now, and rapid response is my patient is declining, I need the stat team, but I'm not coding yet. If I hit back or home, I go back to the front screen, where if I hit clean screen, I can set this to clean or timeout for 30 seconds. Now I can wipe this screen clean without accidentally setting off any alerts. The most important thing to remember here is that anything that you start on this screen, you have to stop on this screen. So if I hit a code blue or a medical emergency from this screen, I would have to hit it again to stop it. Hitting this button simply silences the alarm coming out of this speaker. It does not end the call. I have to hit the same button again to cancel it.